Back to the video. This is the part 2 of shoulder joint. We talk about the shoulder joint in this heading. So first we told about the introduction part, then factors, the ligament, the bursa, and the picture of the shoulder joint and the lateral view. Okay, you have to know every single thing in order to pass the exam, also in the viva. Okay, the next thing we're gonna talk about the movements around the shoulder joint. So this is some picture I already shown you, but then the movements. Okay, you know the movements: the flexion, extension, abduction, abduction, medial rotation, lateral rotation, and circumflexion. Okay, uh, so there is a two type of muscle involved in this movement: main and accessory. Okay. Mm. So the flexion, the muscle is responsible for the flexion is the pectoralis major. Okay, and the deltoid. The which part is responsible for the movement is also important. This is the clavicular head of the pectoralis major, and the anterior fiber is responsible for that, and then the coracobrachialis and the bicep brachii. Coracobrachialis and the bicep brachii. Okay, short headed. Second, one flexion is complete and the extension. Let me show you the movements first. So this is the movement. This movement you can see. This is the flexion. Okay, the muscle is responsible. This is the pectoralis major, and this is deltoid, anterior fiber. The accessory muscle, let me remove this is the coracobrachialis and also short half of bicep brachii. Okay, and then the next one. So the extensor is the movement of extension is responsible for the deltoid. It is also deltoid, but this is the posterior fiber. Okay, this is anterior, this is the posterior, and one muscle, latissimus dorsi. Which nerve is going to supply this muscle? Give me the answer in the comment. Then the accessory muscle, teres major. Okay, then the tricep and the pectoralis major also. But in the exam you don't have to write the accessory muscle in detail. Just mention the main muscle with the head, which head is responsible for the deltoid. The anterior fiber is responsible for the flexion, then the posterior fiber responsible for the extension. Okay, so you have to mention the head, but the accessory muscle, if you remember the names you can add, but don't have to write all over all the muscles. Okay, so let me show you the picture. This is the flexion, you can see. Okay, so this is the posterior fiber of the deltoid, and this is the latissimus dorsi. Okay, this is the bicep, tricep, and this muscle is teres major. Okay, you can also download from the app in the Play Store or some other website, whatever. So third is adduction. Adduction is responsible for the pectoralis major and latissimus dorsi. Okay, there is the sets of muscles: teres major, coracobrachialis, bicep, and tricep. Okay, the abduction. This abduction. This is the important thing. Let me. So abduction. The first 0 to 90. This angle is created by two muscles. One is supraspinatus and the second is deltoid. Okay, deltoid is responsible for all the movements around the shoulder joint. So deltoid is the very much important muscle in for your exam or viva oriented. Okay, then 90 and 180. This angle is created by also not also, this is serratus anterior. Okay, then up to 100 degree, beyond 100 degree is responsible for the is created by the muscle of trapezius. Okay, the 0 to 90 degree, the first initial angle is created by supraspinatus and deltoid. The next phase 90 to 180 is responsible for the serratus anterior, and the last beyond 180 is created by trapezius. Okay, you can see the abduction. Okay, this is the adduction. Okay, this is adduction. Which muscle? This muscle, pectoralis major and trapezius. This two muscle is primary responsible for the movement. Okay, so you can see the first initial is by the deltoid. Okay, deltoid and supraspinatus. This supraspinatus. Okay, and then the beyond, this is the 0 to 90. If I tell, this is the 90 degree. Okay, beyond this is the 190 and 180 is responsible for the serratus anterior. Okay, and beyond 180 is created by the trapezius muscle. Okay, how to think? The medial rotation is easy enough. The medial rotation is subscapularis. Okay, the lateral is the deltoid, and circumduction, all the muscle involving in the above movement is also responsible for the circumduction. Circumduction is the combination of all the above muscle. Okay, creating a circle like motion which cover all the muscles and as well as the movement, because the all the muscle is involved. So this is deltoid. Okay, let me show you the, this is the medial rotation. You can see there is main is responsible with the subscapularis. This muscle, okay, this muscle responsible for the medial rotation. Then this is the lateral rotation. This is responsible for the posterior fiber of the deltoid. This is deltoid, the posterior fiber. Okay, that's all the things you have to know.